Welcome to Medisagas, Tales in Medicine. This is Liam, your narrator for these incredible stories that were researched and written by physician and author, Dr. Rod Tanchanco. Prepare to be captivated by tales of perseverance, serendipity, medical misadventures, and the endless quest to conquer diseases. If you love history and true medical drama, then you're in the right place. Thank you for listening. Many of us have been touched in some way by Alzheimer's disease. It is frightening. It is devastating. It extorts a heavy toll, emotionally, physically, financially, from loved ones and caregivers. And sadly, there is still no cure. In this episode, we travel to Germany at the turn of the 20th century. The setting is a mental asylum in Frankfurt, where the paths of a deranged woman and a progressive young psychiatrist would cross. This podcast's main reference is the excellent book, Alzheimer, The Life of a Physician and the Career of a Disease, by authors Konrad Maurer and Ulrike Maurer, translated by Neil Levi with Alistair Burns. Welcome to this episode titled, Dr. Alzheimer Discovers a Disease in a Mental Asylum. Frankfurt, Germany. The city bustled as spring arrived in 1901. It was an era of transitions, where medieval buildings in the Altstadt contrasted with the modern architecture in the city. Unified Germany was still a young country. It had been barely 30 years since the German Empire was founded. With its museums and theaters, the city had a rich cultural tradition. Like much of Europe, Frankfurt was adjusting to industrialization and the many challenges and opportunities it offered. City infrastructure, including transportation, was changing. The main river cutting through Frankfurt was a critical trade route. The city's train station, the Frankfurt Hauptbahnhof, was one of the busiest hubs in Europe. One of the railway clerks was Karl Deter from Murfelder Landstrasse. Our story begins with Karl. On one of those spring days, he found himself quite confused, bewildered, as he had no idea what was happening to his wife, Auguste. They had been so happily married for 28 years. But on this day, she completely caught him off guard. It was March 18th, 1901, and out of the blue and out of character, she had a fit of jealousy and accused Karl of going on a walk with one of their female neighbors. According to Karl, the accusation was unfounded. In the days that followed, Auguste remained suspicious of Karl and the neighbor. As weeks passed, things only got worse. Auguste's memory began to fail rapidly. The once organized and industrious homemaker was making uncharacteristic mistakes in preparing home meals, a task that she had performed countless times. She left housework unfinished as she roamed around the apartment and hid things for no reason. When she left their home, it would be to ring other people's doorbells. She grew paranoid, claiming that people were plotting to harm her or were talking about her. Before this sudden change in behavior, Auguste had never been seriously ill. She was a healthy 51-year-old woman who did not drink alcohol nor suffered from any mental illnesses. Sure, she could get excited and nervous, but according to Karl, she was quote-unquote rather amicable. After enduring several months of this, in late November of 1901, Karl was at his wit's end. By that time, Auguste had already been examined by their family doctor, who recommended that she be confined in a mental institution. His note read,
Mrs. Auguste D., wife of the railway clerk Mr. Karl D., Murfelder Landstrasse, has been suffering for a long time from weakness of memory, persecution mania, sleeplessness, restlessness. She is unable to perform any physical or mental work. Her condition, chronic brain paresis, needs treatment from the local mental institution.
Karl had no other choice. He brought her to the asylum for the insane and epileptic. The asylum had an interesting history. It had many names, including Madhouse, Bedlam Castle on Monkey's Rock. Monkey's Rock referring to the area where the facility was built. Frankfurt residents called the imposing, Gothic-style building the Castle of the Insane. The structures and grounds had an extravagant look, with no high walls surrounding the property. Completed in the 1860s, the asylum was radically different from the typical prison-like mid-18th century mental institutions. It had vegetable beds, fruit trees, wide open spaces, bright, sunlit interiors, and areas divided by gender and types of illnesses. Around the property were gardens of all types, special ones for paying first-class patients, a normal garden for the normal class, one for the troubled, another for the epileptics, and another for the raving mad. It was a new and progressive approach designed by one of the equally radical and renowned psychiatrists, or alienist as they also called themselves, Dr. Heinrich Hoffmann. A popular gregarious doctor, he had toured all over Europe with an architect, studying old and new institutions before coming up with the final design. Dr. Hoffmann summed up his guiding motto in building the asylum.
It must have above all be so that the entrance of the doctor into a unit has something of sunrise above it.
100 patients were admitted to the new asylum in May 1864. Less than 2 decades later, it housed more than 200 and was overcrowded. Hoffmann later wrote in his memoir,
Humanity has become predominantly nervous and increasingly predisposed to nervous illnesses.
Dr. Hoffmann belonged to a psychiatry school of thought called somaticists. He firmly believed that beneath every mental illness lurked a physical cause. That is, there must be something physically wrong with the brain. That something lies within the body, deep inside tissues that could be discovered with autopsies and microscopes. He dismissed the other school of so-called psychicists, who claimed a more abstract idea of mental illness as a problem of the mind. Other psychiatrists shared Dr. Hoffmann's views, including one doctor, Dr. Emil Scioli, who took over as head of the asylum when Dr. Hoffmann retired in 1888. 36-year-old Dr. Scioli, a tall, imposing man with a kind face, was in a difficult position when he inherited the directorship of the asylum. They were past full capacity, admitting more than 250 patients a year, and he desperately needed help. He sought to find a doctor who also shared his philosophy, a somaticist like him and Dr. Hoffmann. Someone adept with a microscope, a talented researcher, a scientist, and of course, a capable physician. When he received the application of Dr. Alois Alzheimer, a 24-year-old newly minted doctor, Dr. Scioli wasted no time. Dr. Alzheimer's curriculum vitae seemed to check all of Dr. Scioli's boxes. It listed extra training in microscopic examination with the eminent Swiss histologist Rudolf Albert von Kölliker, and experience as a doctor who traveled with and treated a mentally ill woman for 5 months. The application showed that Dr. Alzheimer was born in Bavaria. He was the second son of a royal notary and attended a university in Würzburg and Tübingen. What the CV and application did not reveal was how deeply his passion was growing for histopathology, that growing branch of medicine which studied diseases by exploring tissues at the microscopic level. Nor did it list his playful, lively nature. He once dabbled in fencing, and during one match, his left cheek was gashed with a fencing blade, leaving a long scar. During his school days, he was inclined to dish out pranks or perform stunts like swimming across the main river in winter, or creating a racket outside a police station, or riding down the street in a carriage wearing a silly costume. But he did take his studies seriously and earned his medical degree following a doctoral thesis about, of all things, earwax glands, complete with exquisite drawings of the images that he painstakingly studied under the microscope. On December 18, 1888, Dr. Alzheimer began his internship at the Asylum for the Insane and Epileptic. In the next couple of decades, this psychiatrist with a microscope would make his indelible mark in the world. But it was by no means an easy start for the young intern. In later years, Dr. Alzheimer recollected on the asylum conditions.
The institution accommodated only the most severely mentally ill. Everywhere cursing, spitting patients sat around in the corners, repulsive in their manner, peculiar in their dress, and completely inaccessible to the doctor.
Together with his boss, Dr. Scioli, and another brilliant colleague, Dr. Franz Nissel, the trio introduced changes to improve conditions in the asylum. They renovated the building layout, implemented the non-restraint principle of treatment, introduced the very effective long bath treatments, conversation therapy, and continued to research the physical causes of mental illnesses. They wrote numerous papers and attended as many medical conferences as they could. Within a few years, they had established their names in the medical community. Dr. Alzheimer's stature grew as a lecturer and scientist. He became the expert on brain histopathology as his slide collection of tissue samples expanded. Even the very influential and highly respected psychiatrist, Dr. Emil Kraepelin, took notice. In one particular conference in Dresden in 1894, Dr. Alzheimer gave a lecture in front of 85 top psychiatrists. He spoke about his favorite theory, that arteriosclerosis, or blockages in the blood vessels of the brain, was an important cause of senile dementia. At the time, syphilis was still a common cause of mental decline. But Dr. Alzheimer presented 12 cases of patients with dementia and other neurologic findings, but had no signs of syphilis on autopsy. Instead, his pathology slides revealed the abnormal blood vessels all the way to the smallest branches. Dr. Kraepelin asked Dr. Alzheimer,
"My colleague Alzheimer, could you exclude traumas as causes?"
I could exclude traumas, diabetes, nephritis, and an uncompensated heart insufficiency. My cases are very close to dementia senilis in that it would be a mistake to classify them with general paresis, but I can sharply distinguish them from so-called dementia senilis precox.
Dr. Alzheimer's preoccupation with his theory was important, as we will soon see, when he encountered the woman suffering the diagnosis that would bear his name. By 1895, the well-established and respectable Dr. Alzheimer has risen to chief physician of the asylum. In the same year, he got married and the couple welcomed a daughter. By 1900, there were 3 children in the Alzheimer household. 1901. The year began with tragedy when Dr. Alzheimer's wife passed away from an unknown illness. The grieving doctor remained boundlessly busy, taking care of patients, managing the asylum, performing research, and with every opportunity, spending time with his children. And that brings us back to where we started. That spring day when Karl Deter, the railway clerk from Moorfelder Landstrasse, found himself accused of taking a walk with another woman by his suddenly jealous wife, Auguste. The situation spiraled in the ensuing months as Auguste became more and more disorderly, forgetful, paranoid, restless. It all happened without any warning. In late November of the same year, Karl had to bring her to the asylum for the insane and epileptic. The day after she was admitted, Dr. Alzheimer was reviewing the previous day's admissions and stopped at Auguste's chart. Something about it caught his attention. It was peculiar. He read the admission notes and the description of Auguste's symptoms and rapid deterioration. He noticed that she was born in Kassel. Dr. Alzheimer's grandfather was a teacher in Kassel. Perhaps she was his student? Among these and the other notes documented, one detail was particularly significant: Auguste's age. She was only 51 years old. She reminded Dr. Alzheimer of another patient from several years back whose case was similar to Auguste's. He had performed the autopsy looking for clues as to the cause, but only found some shrunken brain cells. He had been wondering if his theory on arteriosclerosis causing dementia in the elderly also applied to relatively young people. In that patient he examined years ago, he only saw minimal arteriosclerosis in the brain arteries. As he reviewed Auguste's chart, he surely recognized the importance of her case in further understanding dementias, and particularly pre-senile dementia. Over the next several months, on an almost daily basis, Dr. Alzheimer visited Auguste. He asked her to name common objects, perform simple arithmetic. He asked her where she lived, what year it was, who her husband was, what she was eating, the color of snow, the sky, grass. Dr. Alzheimer kept a meticulous record and even arranged for Auguste to be photographed. One of the photos show a woman with a deeply furrowed forehead and heavy bags under her eyes. She was wearing a white hospital frock, buttoned at the front. Her face bore a resigned, blank expression. She looked lost, fearful. Her hands were draped over her raised knees, with the long fingers securely interlocked. Dr. Alzheimer continued his daily visits and long conversations with Auguste. He could offer no cure, and the limited treatments included sedatives and the long, warm baths that had been very effective for other asylum residents. As her condition worsened, she sometimes spent a whole day in the bath. Other times, Auguste had to be placed in isolation after she groped faces and struck other patients. She wandered aimlessly, sometimes screamed for hours, and became increasingly hostile. There were moments when she thought she was back at her house.
My husband will be here shortly.
By February of 1902, her condition had advanced to the point that long conversations and physical examinations became impossible. She ate erratically and had developed a bed sore on her back. Their last conversation was brief.
Good day, Mrs. D.
Oh, begone, I cannot say that.
Later that year, Dr. Alzheimer resigned as chief physician of the asylum and moved to Heidelberg, and shortly after to Munich to work under Dr. Emil Kraepelin and serve as director of a brain anatomy laboratory. He remained interested in Auguste's case and asked Dr. Scioli to keep him updated. On April 8, 1906, an intern from the asylum called Dr. Alzheimer to inform him that Auguste had died. In her final days, she had shriveled down to 68 pounds and was in a constant daze. She had multiple bed sores and high fevers. The official cause of death was blood poisoning as a consequence of bed sores. Shortly after receiving the news, Dr. Alzheimer received her complete clinic chart as well as Auguste's autopsy specimens. When he examined the brain sections under the microscope, Dr. Alzheimer noticed atrophy of the cerebral cortex. The brain had essentially shrunk. He found diseased neurofibrils, meaning strands of protein filaments in brain cells. He also saw strange deposits that he described as millet seed-sized lesions. Dr. Alzheimer had seen these before, but only in much older people, patients who were at least 70 years old. And Auguste's brain showed a far more severe form when she died at 56 years of age. These microscopic brain tissue findings, now known as neurofibrillary tangles and amyloid deposits or plaques, are typically found in the brains of patients with Alzheimer's disease. The tissue samples did not reveal arteriosclerosis, but what he did find were strong evidence for a different cause of presenile dementia. Dr. Alzheimer's discovery was not immediately well received. In a lecture titled, "A Peculiar Disease of the Cerebral Cortex," he presented Auguste's case and autopsy findings during the 37th Assembly of the Southwest German Psychiatrists in Tübingen. After he presented the case and showed the slides with his findings, the conference chair asked the audience if they had any questions for Dr. Alzheimer. In the countless lectures and congresses that Dr. Alzheimer had given or attended, he had come to expect lively discussions and debate from his colleagues. This time, to his surprise, there was no response. The host asked a second time, prodding the psychiatrists for questions. Silence. Dr. Alzheimer must have been stunned. The chair, hearing no response, moved on.
So then, respected colleague Alzheimer, I thank you for your remarks. Clearly there is no desire for discussion.
The next two lectures were about psychoanalysis. Both were followed by lengthy and spirited debates. Those were the early years for the growing discipline of psychoanalysis and psychotherapy. Perhaps the name Dr. Sigmund Freud rings a bell? Just several years before, in 1900, Freud had published his landmark book, The Interpretation of Dreams. Although Freud's ideas were controversial and he had his share of harsh critics, psychoanalysis then was, in today's parlance, the trending buzz topic in psychiatry. In a way, the concepts of sexuality, libido, dream analysis, repression, and so on seemed more interesting than dead cells on a glass slide. The written minutes of the conference was rather dismissive of Dr. Alzheimer's lecture when it read, quote, unquote, not worthy of a short report. A local press report printed a mere blurb on the lecture. The world was not quite ready for a histopathological explanation for a mental illness. Despite the frosty response at the conference, his lecture was still printed in full in a psychiatry journal. Many decades later, it had become a frequently cited source which traced the first case of the disease that will forever bear Alzheimer's name. Dr. Alzheimer did have the support of other doctors. The renowned and influential Dr. Emil Kraepelin, his boss in Munich, and a fellow somaticist, first used the term Alzheimer's disease in the 1910 edition of his textbook, Clinical Psychiatry, a textbook for students and physicians. The book included descriptions of Auguste's case as well as other similar cases that followed. The disease was still poorly understood, but one of the most famous medical eponyms was born. 90 years later, in 1998, following some incredible detective work which probably merit its own podcast, researchers found and re-examined Auguste's original autopsy slides and confirmed what Alzheimer had seen under his microscope: neurofibrillary tangles and amyloid plaques. As of 2020, the World Health Organization estimated that 50 million people on the planet suffer from Alzheimer's disease. By 2050, this number may triple. The economic burden is staggering. In the US, the Alzheimer's Association estimates the cost to care for Alzheimer's disease patients to be $340 million. Sadly, a cure still eludes us. In 2023, the FDA approved the monoclonal antibody, lecanemab, to treat mild or early Alzheimer's disease. The drug targets and reduces the amyloid plaques, those strange deposits in Auguste Deter's brain that Dr. Alzheimer described more than 100 years ago. This drug was shown to slow the progression of the disease when given to patients with mild disease. A similar drug called aducanumab also targets amyloid plaques, but has had mixed results regarding effectiveness. Researchers all over the world are very actively studying other compounds and exploring other targets, other approaches, in this race to prevent, slow down, and stop the cruel, relentless march of Alzheimer's disease. That concludes this week's episode of Medisagas. We hope you found today's journey both captivating and enlightening. If you enjoyed this episode, please consider subscribing as well as leaving a review on your preferred platform. Also consider becoming a patron of this podcast. Come visit the website and send us your comments, suggestions, or ideas for stories that you want featured in future podcasts. We always appreciate your feedback and support. Thank you.